Breathing in, there is awareness of breathing in. Breathing out, there is awareness of breathing out. Breathing in, breathing out. In, out. Insufferable feelings. Depression. Part 2. Normal depression. Far from everyone who experiences or even has been clinically diagnosed with depression behaves in a generally sullen, lethargic, or withdrawn demeanor. Oh no. As many of us carry on with relatively normal, everyday living, yet invariably express much of our crushing unhappiness and dissatisfaction in passive-aggressive ways. Let others know just how insufferable we feel our life is through the various adverse complaints, criticisms, and comments we otherwise express ourselves through. Pessimism bias. Perhaps an overlooked sign or symptom of frequently undiagnosed and, thus, untreated depression is believing and further expressing via chronic complaints, unkind criticisms, and general patterns of seeing the negative in almost anyone and everything. Expressing how deeply we feel victimized regarding our lot in life, as well as sheer hopelessness in anything or anyone changing to make us become happy or full of joy. Mixed features. When someone says to us that they are depressed or have been diagnosed with a depressive disorder, one might believe they live a rather melancholy, pitiful, or even lazy existence, when, perhaps instead, they experience and display restlessness, agitation, or even mania, which in themselves could suggest an anxiety disorder as well as a bipolar disorder. Wanting to be depressed. Despite a very conscious desire to end one's depression, unconscious feelings of less than, not good enough, unworthy, or undeserving, among others, actually sabotage our efforts by invariably setting ourselves up through sour moods and poor attitudes, as well as complaining, criticizing, and general pessimism that essentially causes others to criticize, ridicule, and even reject us in return, essentially gives others reason to avoid us so that we become further isolated, lonely, and even feel more depressed.